So in terms of the most important changes for patients to be aware of here in San Antonio is the breast density part of the regulation. And the good news is it really is not going to change anything that you're already doing or that our facilities are doing, because this law has been a part of the Texas state laws since 2012. It was enacted. It was called HINDA's law. And basically, so we've been in compliance with this since 2012. And basically, the law requires that every patient receive in their lay letter on their screening mammography report a paragraph about the density of the breast. Do they have dense breast tissue, or do they not have dense breast tissue? And if they have dense breast tissue, they are encouraged to discuss that with their primary care provider, not with the radiologist, not with the surgeon, but with their primary care physician, and discuss it, specifically determine if they have other risk factors such as family history that are additional risk factors, and then make a decision as to whether the screening mammography is enough for them, or would they benefit from additional supplemental breast imaging screening. And that's a conversation that should then be had between the patient and their primary care physician or primary care provider. Now, in terms of supplemental screening that's available and that we provide at the Baptist Breast Centers, for example, would be a whole breast screening ultrasound that looks at the breast using ultrasound rather than x-rays, which is a mammography is really just a specialized x-ray. And ultrasound is a different way of looking at the breast tissue and is a way for us to detect additional cancers. The benefit is we can detect more cancers with breast ultrasound. One of the drawbacks is that we also find a lot of additional benign findings in the breast that are not cancers, but we're not sure, and we either have to follow them very closely or we either have to do needle biopsies. And so the drawback is that women may end up getting more biopsies or having to return more frequently to get reassessed by ultrasound. Another